I'd like to go on now and talk a little bit about another reproductive organ called the breast. Before the days of formulas and some of the artificial things that we can produce to feed babies, the breast was certainly a vital organ for the baby. If there was no breast milk available, all babies died. There was no other way to feed the baby. It didn't have to be the baby's own mother. It could be someone else, but the baby needed to get milk from the breast, or it could not get the nutrients or the antibodies necessary for survival. So it's an organ of reproduction. The breasts are called the mammary glands, and they are actually, as I think I mentioned before, modified sweat glands. They are apocrine glands capable of making milk and also releasing some of their structure into the duct system, so they lose a little bit of their cellular material as well, and that defines an apocrine gland. The sweat gland is another one of those. Those are the two apocrine glands that we see most often. The basic structure, as you'll see here, is called the lobule. These are the lobules of the breast. They're in clusters. There tend to be about anywhere from 12 to 20 of these groups, and these are the functional part of this structure that makes up and secretes in the non-pregnant patient just a clear fluid, and in the pregnant patient eventually milk. The ducts of these lobules are lined with an epithelium. As you can see here, they join like the branches of a bunch of grapes, and they each lead into a solitary duct which is hollow, lined with a single layer of epithelium, and they meet and drain into contiguous ducts which become bigger as they approach the nipple. There's a small swelling at the end called the sinus, which holds a little more fluid, and finally they empty into about anywhere from 6 to 8 openings in the nipple itself. Now, the nipple is surrounded by something called the areola, a pigmented area that contains smooth muscle, and there's smooth muscle throughout the duct to help eject milk and to help the lobules get their milk down the duct. The breast is on the anterior outer surface of the chest wall. There's ribs and muscle between the breast and the chest, and a membrane here that separates it. There are also ligaments in the breast that help support the breast. And the breast is primarily divided into either breast tissue, as shown here, or fat separated by the ligaments. And with aging, the proportion of breast tissue to fat changes. This is significant, for example, in a mammogram, an X-ray. Fat allows the X-rays through. The breast tissue doesn't allow it very well. And so what happens is mammograms are far easier to interpret in an older patient because it's mostly fat and tumors show up as more dense material, whereas in the younger patient you have a lot of dense breast tissue, tumor can be hidden more easily in that breast. The male breast is very similar, but the male doesn't have any lobules because the male has no need to secrete milk. Evolution gave the male, a long time ago, both aspects of breast tissue, but evolutionarily we've lost this over the thousands of years, and men are left with just ducts and very little breast tissue of any other kind. So this means that men can get breast cancer, same way women can get breast cancer, but women get both lobular and ductal cancers, cells arising in one of those two components, and men can only get ductal cancer. And interestingly, it presents the same way, it has the same treatment in a man as a woman, and often the same prognosis. It's not that different a disease. However, because of hormone considerations, there's usually one male breast cancer for about every 100 female breast cancers, and I'll talk about that a little bit later on.